Hello and welcome. Thank you for tuning in to our research poster. My name is Ashley Radomski. On behalf of an incredible multidisciplinary team at the Knowledge Institute on Child and Youth Mental Health and Addictions and CHIO Research Institute, we are excited to share a current research study called Exploring Youth Mental Health and Addiction Service Experiences and Preferences through Participatory Action Research. The COVID-19 pandemic spurred massive and abrupt changes to mental health and addiction services, and a system that already had a long-standing history of not meeting the needs of young people, especially those from vulnerable backgrounds or diverse identities. However, the pandemic also brought about changes that improved access to care for others. So to learn about how these service changes impacted youth, we decided to hear from youth themselves. We conducted a participatory action research study. PAR is an approach to research that focuses on young people's real-life interests, needs, concerns, and ideas, and centers around their active participation. So as they co-lead a project, meaningful outcomes can be achieved. We recruited 4 youth partners who had lived experience to join the team in co-designing all that you'll see next. This study involved 2 major parts. The first part included data collection by way of focus groups. Together with the partners, we refined our objectives. They were to update our understanding of young people's awareness of and access to mental health and addiction services before and since the pandemic, and to explore how these vary on dimensions of equity and diversity. We used social media to recruit and enroll diverse youth who were between 12 to 24 years of age, living in Ontario, and had lived mental health and addiction experience. A self-report questionnaire was administered during eligibility screening. Participants were purposely selected to generate a diverse and typically underrepresented sample. Partners co-designed a structured focus group guide based on our objectives. We conducted 5 virtual focus groups with 40 participants in December 2022. Focus groups were 2 hours, led by 2 co-facilitators, recorded and transcribed. During data analysis, 2 coders coded all transcripts using in vivo and a codebook based on the focus group guide. Through team discussions, intercoder reliability was established and emergent themes were identified and described. This table displays the self-reported sociodemographics of our diverse sample of 40 youth. Youth had a mean age of over 21 years. Half of our sample identified as male, and many considered themselves to be from a variety of ethnic backgrounds. More than 3/4 of our sample had a current mental health and addiction concern, and half received help during the pandemic. Young people shared various experiences and suggestions for improving their awareness and access to mental health and addiction services. We identified 6 major themes and multiple sub-themes that spanned young people's awareness, access, and suggested improvement for services in the mind map that you see here. Briefly, here's an overview of the major themes. Issues related to equity and diversity are largely reflected in system constraints, preferences and choice, and convenience. Please email our team for more information about these findings. The second part of the study was to co-design knowledge tools that support young people's awareness and access to mental health and addiction services. Mind Your Mind facilitated 7 design lab sessions for partners to co-design knowledge tools. Focus group findings and the partners' lived experiences informed and inspired the tools. Here is an overview of what the 7 sessions entailed. Principles of PAR and co-design guided the process. The final product was an interactive workbook-style toolkit called Participating in My Mental Health Care. 4 fillable worksheets make up this toolkit and help youth move through an empowering process of identifying what support or services youth may want or need, and how to take the steps to seek out relevant and appropriate support. In December, we're planning to share the toolkit online so that it's available to young people in Ontario and across Canada. Here are screenshots of the toolkit. It is available in English and French, and there is a complimentary version for parents and caregivers. As a next step, we are building upon youth suggestions that webinars are a desired way to improve their awareness of services. We have a new CIHR grant that will bring together various partners, perspectives, and the best available resources and evidence to co-design a national webinar series to improve young Canadians' awareness and access to mental health and addiction services since COVID-19. This is a planning grant that will be used to prepare an application to fund the webinar series. We'd like to thank the partners Mind Your Mind, the Knowledge Institute's communication team, and CIHR for their valuable contributions to the study. Here is our poster once more. And if you'd like to learn more about this study, please email our team. You can also use these QR codes to access our materials. Thank you.